Hello and welcome to the weekly COVID and wellness update brought to you by Prisma Health Business Health Solutions. I'm Medical Director of Prevention and Wellness, Dr. Rachel Brown, and I've got a lot of information to share with you. But again, let me reiterate, as I have in past videos, that the information you hear today, this is January 21st, this recording date, may be different in a matter of hours. Things are changing so quickly. So there are a couple of ways you can make sure you have the most up-to-date information. I'm going to share my screen so I can show you how to access that. So first of all, we have our webpage, the Creating a Safer Worksite webpage. And if you scroll down, you can find a contact us button or a number that you can call. And we're happy to talk to you. We can answer your questions by email. We can set up a consultation call, whatever it is that you'd like to do. We want to make sure you're not confused about what's going on right now with the vaccine. The other resource that's very helpful is the Prisma Health COVID-19 vaccine page. And you can see we are always updating this page daily, it seems. And so the most up-to-date information about who can be vaccinated, how they can request a vaccine, and who's going to be vaccinated and when is here on this website. So please use this to make sure that you are getting the most up-to-date information. I'm going to stop sharing my screen for a moment so we can do what we always do at the top of these videos, and that is talk about the disease burden across South Carolina. So unfortunately, we have surpassed 400,000 cases. We're at 404,492 cases. Our percent positive over the last 2 weeks, the average is 26.9. Yesterday it was 23.3. The good news is this is a plateau. It's a little bit lower and it's a plateau. Looks like we may be past the holiday surge, so fingers crossed that those numbers continue to drop. When we look at a few counties across the state, Greenville has 1,625 cases per 100,000 folks and a percent positive at 33.7, which is significantly down from last week's 38%. Oconee has 1,379 cases per 100,000 with a percent positive of 32.6%, which is a little bit up from last week. Richland has 939 cases per 100,000. Richland's percent positive has dropped to 19.5%. And Sumter is seeing 830 cases per 100,000 people with a percent positive at 22.8, staying about the same as last week. So there you have it. The numbers are still high. We still need to do what we can to stop exposure and to stop spread. We'll talk about that a little bit more later. But let's get to the vaccine because that's what everyone wants to know about and wants to know what's coming. So again, I'm going to share my screen with you to show you some good resources from DHEC that you can access. All right, this is the South Carolina DHEC COVID-19 vaccine page, and it is chock full of important information. First of all, right here, you can see who is being vaccinated right now and who is coming. If you need a little bit more detail, scroll on down. This has been the most helpful list for us. It's a very detailed list of who's in 1A. If you scroll down a little bit further, when we're talking about 1B, which will be the next phase, little less detail, but still some information here that can help you to know whether your business, your workforce, your friends, family, community are next in line. You can bet that once we enter phase 1B, the same type of list here that's listed for 1A will be generated for 1B. So we'll get even more details as we get closer to those phases. And the same thing here for phase 1C and for phase 2. So the next thing I want to tell you is that in general, you'd remember healthcare workers, long-term care facility residents and staff have been vaccinated, along with frontline and first responders. But we've also added folks who are hospitalized or in emergency departments who are over the age of 65 and folks in the community who are over the age of 70. So how do these folks get their vaccine? Well, again, let me refer you to our Prisma Health page, COVID-19 vaccine. they can push the vaccine request button right there, and they will be registered with VAMS, and if they are indeed part of that eligible group, VAMS will send them an invitation to schedule their vaccine appointment. If you are an organization that has a portion or all of your workforce that is in the eligible phase, please reach out to us. We can also send you a spreadsheet so that you can enter the information for your workforce into that spreadsheet, and we can register you in VAMS on your behalf. If you've got a population that does not feel tech savvy and cannot complete the online VAMS registration or doesn't have an email, we have ways to help you as well. So anyone who is eligible for their vaccine can walk into our vaccine sites and we will register them there if they are not able to do that on their own. Okay, so I'm going to go back to the DHEC page. So we've talked about how you can use Prisma Health and our Prisma Health sites to get vaccinated. The other places to look are Ingalls and Publix. There are some Ingalls and Publix that are giving the vaccine now, and we're hoping other retail pharmacies will be able to provide that service as well. And then finally, we've got at the top of the DHEC page, the finding a testing location. Now, if you click on this button, this is going to take you to a map of South Carolina, and it's going to indicate which sites are ready and active as enrolled vaccine administrators. Our problem, however, is that not all of them have their supply yet. So be sure to read the fine print. Make sure you know whether the site that you're investigating has its supply. We are struggling a little bit in South Carolina to get the requested amount of vaccines that we would like, but we are hoping as Operation Warp Speed sees how well South Carolina has been doing in vaccinating the 1A folks, that they will begin to send more of the requested doses. So lest you get discouraged by some of the things you may be seeing on social media or some of the reports you may be hearing, South Carolina actually is doing an incredible job of getting folks vaccinated with the supply that they have. All right, I'm going to back out from sharing my screen so we can talk a little bit more about what's coming down the pike. So first of all, the Moderna vaccine. Once the Moderna vaccine becomes more readily available, you're going to see many, many more vaccine administration sites. As some of you have heard, the Pfizer vaccine is difficult to transport and it's difficult to storage due to its ultra cold freezing requirements. The Moderna vaccine does not have these same requirements. Prisma Health is actively working to get more Moderna, or to get the Moderna vaccine. Right now, the Moderna vaccine has been allocated specifically for long-term care facilities, which is being administered by CVS's and Walgreens. And as soon as Prisma Health receives the Moderna vaccine, all of the vaccine sites, primary care offices, mobile units, other things that we've been working on behind the scenes while we wait can be deployed so that we can increase that access to vaccination. We're also waiting to hear about the self-enrollment app or online registration process that DHEC is working on. This is a very, very exciting development, with the idea being that instead of having to work through Prisma Health's registration process, community members can register, will be able to register on their own if they are in the eligible group of folks who can be vaccinated, and then choose the site where they can be vaccinated. That, of course, will make things very easy for everyone. However, again, for those who are not tech savvy or maybe don't have access to these types of connections, our Prisma Health sites are already set up to take folks and register them for them and set them up with the required VAMS information that they need. All right, let's talk about some of the new vaccines that are going through phase 3 trials. I've talked to you before about AstraZeneca. This is also a 2-dose vaccine with a 3-week period in between the 2 doses. can be refrigerated. But I want to focus on Johnson & Johnson because some of you have asked me about this vaccine. This is the one vaccine in phase 3 trials where they've been looking at the data around the efficacy of one dose, which would be wonderful, right? This is also a vaccine that can be refrigerated. It doesn't need the ultra cold storage component. So the word on the street is that Johnson & Johnson may get its emergency use authorization even early in February, which would be wonderful for us. That's a third option with very simple logistics to navigate. I do want to say, so that you have the most up-to-date information, there is a likelihood that Johnson & Johnson would still remain a 2-dose vaccine for folks who are 65 and older, simply because their data that they're analyzing is beginning to show that the 1 dose may not be as effective in that age group. So we're just going to sit tight and wait to hear what they say and hope that soon we have a third 1-dose option. Before we close for the day, I want to talk to you about something that's very important for you as employers and really for all of us who are advocating for vaccinations, and that is vaccine hesitancy. So you may have a workforce or portions of your workforce or individual employees who aren't sure about getting the vaccine. And we want to honor everyone's opinions and feelings about this vaccine, but we also want to make sure that they are armed with the most relevant and important information so that they can make the best decision for themselves. So there are a couple of resources that you can use to help you in communicating with your workforce if that's something you want to do around vaccine hesitancy. I'd like to share one with you. If we can get to it. Here we go. So this, if you search for the American Pharmacists Association vaccine hesitancy, they have a wonderful document here that not only has other resources for you to access, but talking points and approaches and frameworks for understanding where your workforce is and how they feel about the vaccine. And then certainly addressing any hesitancy that you feel like you may be able to address. But let me share with you a couple of tips before you have a chance to go and look at that document. So number one, understand your population and create trust. Okay, so one way you can do this, Prisma Health Business Health Solutions has developed a survey tool, if you'd like to use it, that asks how people feel about the vaccine and what may be some of those barriers. Another way to create trust is to find vaccine advocators who represent the diversity of your organization. So folks within your own workforce who may be influencers, but again, reflect the demographic of your population. You want to tailor your messaging. So once you understand your workforce and where they're coming from, you can message in a way that's relevant to their concerns or relevant to cultural issues that may come up. You want to provide good education. Okay, so for instance, I get questions all the time about anaphylaxis, which are severe, scary reactions to the virus. And folks have a sense that this one causes more of those kinds of reactions than the typical vaccination. And when in reality, the incidence of anaphylaxis with the COVID vaccine is 1 in every 100,000 vaccine recipients. The flu vaccine, on the other hand, has a severe reaction in 1 out of every 5,000 participants. So while that perception may be out there, it doesn't match what the facts are. And so you want to make sure they're educated. That's where we come in. We can help you with that. Certainly the Prisma Health webpage is also there to help you know exactly what the facts are around the COVID vaccine. You may want to consider incentivizing, and you certainly don't want to do anything that's going to feel punitive to folks who aren't getting the vaccine, but you may incentivize by recognition, small treats, free meals in the cafeteria, things like that. Make sure that access to the vaccine is available and easy. Now, this is more for folks who may pursue becoming a closed pod or may work with us when your workforce becomes eligible to do on-site vaccinations, but we want to make sure it's easy. So we got to think about, when are folks in the building? Do we need several shifts? Are leaders empowered to let their team members go so that they can get this vaccination? And you also want to make the experience a good one. You'll see that throughout the literature. I'm seeing vaccine sites where they're celebrating the folks that come in, and there's music and there's fun, and the 15-minute waiting period that folks have to participate in after they get the vaccine, there are activities that they can do. And so if you are a site that ends up hosting a clinic, think about how to make it as fun as possible. And so those are some tips on how to address vaccine hesitancy. It's really about understanding and showing empathy for folks who may have some real concerns about getting the vaccine. And then it's also about making it as easy as possible for folks to get it. So again, please feel free to reach out to us if you have any questions at all, if you need clarification, if you need consultation. And please, please encourage your employees, your families, your friends, your communities to continue to follow precautions, masking, social distancing, no big gatherings. We really need all of the pieces of the puzzle, not just the vaccine, to get this under control. South Carolina has over 6,000 deaths right now due to COVID. We don't want to see any more of that. So continue to encourage folks to follow those precautions. Continue to watch our videos so that you can get great information, and I'll continue to give you the best information we can. We want to care for you so you can care for your employees.